And it got to the point where, I reached out to the two big providers that I was using at the time and said to them, these are my biggest pain points. Have you got, any plans to bring these features in? And both of them essentially said, not at this stage.
Hey guys, it's Shane here, founder of A Culture of One, and this is my interview with Alex Forde from Pogozo. Now, with this interview, we went pretty deep in her journey from physio to pharmacy to running her own tech company, and the conversation went for a fair while. So I've actually split it into two parts, and what you're going to see now is part one, which is the founder journey and why she built Pogozo. I hope you enjoy it. My guest today is Alex Forde from Pogozo. I've been looking forward to interviewing Alex ever since we met at the Focus 24 conference, which was nearly a year ago now. And I'm sure she's got heaps to update me on. Amongst all the things, I've seen Alex as a physio, a pharmacist, and a practice owner, someone who's building practice management software, but she's just told me she's actually more of a tech bro now. So welcome, Alex. So great to have you.
Thank you so much, Shane. It's great to chat to you today.
Awesome. So why you're a tech bro? You're not a physio.
I know. I have this conversation with friends all the time. I don't quite know how to introduce myself anymore. But yeah, I've always loved learning. I've always loved trying new things and challenging myself, and being a tech bro at Pogozo is just my current challenge.
Awesome. You've done a lot, and we're going to try and squeeze this into like 2 or 3 minutes. But do you want to take me back over your career from graduating from physio school and how you've ended up where you are with Pogozo right now?
Yeah, absolutely. So I finished physio in 2000, I guess. And so worked in private practice for a couple of years, loved it. Always thought that I would own my own practice one day. And so after being in physio for a couple of years, I decided to go back and study my Masters of Business, so MBA. So started doing that, was really enjoying it, and I got halfway through the MBA. So I was doing it part-time. So halfway through the MBA, and I was seeing a lot of clients at the time that had chronic conditions. So lots of chronic pain. It was something that I was really interested in. And I remember I had this case with a patient, and they had these weird symptoms and I couldn't quite figure it out. Anyway, long story short, the reason they had these symptoms was because of a medication that they were on.
Mm-hmm.
And I realized that I was struggling to do my job as a physio who worked with chronic pain and clients with chronic diseases because I didn't understand enough about medications. I searched high and low for a course that I could do about medications, couldn't find one. And so I figured I'd just go and do pharmacy so I could learn as much as I could about medications.
Yeah.
So I
just tag that on top of the MBA.
Exactly. So there was a year there that I was studying pharmacy here in Brisbane. I was doing an online MBA through Castle University, working full-time as a physio. So that was a very busy year. And yeah, finished as or was in fourth year pharmacy. And that's where I really had to think about, well, what was the rest of my career going to look like? So to become a full-fledged pharmacist, I needed to do a registration year, and I'd chosen to do that at the hospital. So I needed a bit of flexibility in my role as a physio. And I decided I could get that flexibility by being my own boss. And so that was the stage that I opened my own clinic. And I say clinic because it was a room at the back of a gym that I happened to be a member of. And I, started my sole trader journey in that position.
Nice.
Yeah. So, I was doing my own thing as a sole trader. I was working full-time as a pharmacist. Over the next maybe 5 years, I increased my physio hours, decreased down my pharmacy hours. I actually started another side business that was called the Physio Pharmacist, and ran a couple of courses for pharmacists on medications. So, and did a couple of face-to-face, did a couple of online things. And that was really great, really enjoyed that. And then COVID hit. And so I was in this position with COVID where, like, a lot of physio owners, my business had grown at that point. We'd moved into a, different clinic. I had staff underneath me. I was still working at the hospital as a pharmacist, but my private physio clients were really nervous about me working in a hospital because that was where we were likely to catch COVID.
Yep.
And so I had to make a decision, was I going to step away essentially from physio or pharmacy during that time. And this is the very beginning of COVID, where we didn't know, what it was going to look like and what lockdowns were going to be and all of that kind of thing. So essentially, I wound up my pharmacy at that stage to concentrate on physio business. A couple of years later, so still technically during COVID when, lockdowns were still happening, I partnered with a friend of mine and we opened a CrossFit gym as part of our physio clinic and multidisciplinary clinic. And this is where the software journey started. So having a CrossFit gym, running 40 plus classes a week, having memberships, we needed a software that could help us do that, but also software that would support us with our physio stuff as well. We were using at one stage about 12 different softwares, and that includes things like email, and we had a phone in the system, in the clinic, I should say, that we could send text messages from ad hoc. So, 12 different things we used all day, every day to communicate with our patients, to take bookings, to take payments, all of that kind of thing. And it was getting really expensive. It was getting, hard to keep track of all of the subscriptions, and we were double handling a lot of things because, not all of the systems talk to each other.
And just quickly, this is exactly what Alex and I are going deeper on in our free webinar on Thursday, September 18th. If saving 10 hours of admin a week sounds like something your clinic needs, grab the link below and register. Now back to the interview.
And it got to the point where, I reached out to the two big providers that I was using at the time and said to them, these are my biggest pain points. Have you got, any plans to bring these features in? And both of them essentially said not at this stage. And so if you know me, this is where my personality kicked in and I went, come on, it can't be that hard. I'll just go and do it myself.
Exactly. But the thing is, you're running a non-traditional sort of business, but it's not that far outside of what you would think is just a normal business. It's exercise plus physiotherapy fundamentally.
Yeah, exactly. And realistically, the CrossFit part of our gym or our business, it wasn't the CrossFit that was the problem. It was the classes, So it wouldn't matter whether it was CrossFit classes or Pilates classes or yoga classes or GLAD program classes. Like the class type doesn't matter. It's the fact that we ran classes. We wanted to have memberships. We wanted to have a mobile app that clients could book in and manage, their own things. And so, none of the systems that did physio one-on-one did classes well, and none of them really did memberships. And then all of the software that ran classes really well, so essentially built for gyms, none of them did the note-taking, one-on-one appointment stuff. And so we were like, while our business model was kind of unique, it's not really. There are like lots of physio clinics out there who run classes and do one-on-ones. Almost every EP clinic out there does classes and one-on-one. So, there's certainly a very big group of people who run both of those service types and are either struggling with a system that doesn't do it or are doing what we did and are paying for two systems side by side.
Yeah, we kind of get used to systems not working that well and put up with it because I think it's a health thing, right? And I always get in trouble for the stuff I say, but I'm like, I think a lot of us have come through. We've probably worked in public hospitals, etc., and we're just not used to things actually working. It's just kind of half of the course is like, all right, well, you go into this system, you do that. You go into this system, you do that, and you're just running around all day. But when you become a founder, like I think it's a bit different as a clinician because you're kind of just clicking through. But when you're running a business, you need to get into those systems and get depth. You're not just clicking a button and then popping out again. Yeah. And that becomes a real challenge for practice owners.
Absolutely. And you're right. Like as the owner of the business or the founder of the business, I was using every single one of those systems, whereas most of my staff were maybe using 3 or 4 of them. So they were still using a lot of systems, but no one else in the business was using all of them. So the pain point was definitely mine, but what we've built, it means that a clinician really only needs to use one system, which I think just makes, life a little bit easier. And that's, what we're trying to do is just make life easier.
Yeah. Do you think that contributes to people's burnout rates as well? Because it's not as simple as just seeing a patient and writing notes on a piece of paper.
Yeah, look, I absolutely do. I think that, we get really overloaded and overwhelmed with everything that we have to do. And there's more requirements on us to write notes and, write emails to clients and follow up after the first appointment and follow up after the third appointment. And so I think that I've only been a physio for 16 years. I've got friends who've been physios for 30 years. And so the difference between when I started and when they started are huge. But the difference between when I started and now, I didn't have to write anywhere near as many notes, or it was okay to write somebody's exercises on a piece of paper and give it to them. And it didn't, it wasn't scanned into the system. It was, you gave it to them. It was their responsibility not to lose it kind of thing. And so I think at the moment we're really stepping up as health professionals, which is great, but it puts a lot of pressure on us. And I think, and I'm sure we'll talk about it in a little bit, but one of the biggest challenges I see is that clinicians are struggling with what they've got, and so are admin, because they often are using a lot of systems, and owners really don't like having to pay all the subscriptions and manage all of them. It's really scary to change too. So, if you've spent the time to learn how to juggle the 4 systems you've got, it can be harder then to move to something, even though it's going to be easier in the future. It's just sometimes easier to do what you've always done. And that's why there are some physios out there who are still writing exercises on a piece of paper and sending them out rather than using, some of the great exercise software that's out there, because if you know how to do something, it's comfortable to do the same thing you've always done as well.
Yeah, I used to do my work cover PMS or plans. I think it was because I was trying to run a business at the same time, and I was just in that base level of stress where I was like, I know I can just do this by hand and it works. And it's easier for me because I trained in work cover 10 years prior, worked overseas and came back. I was like, I'm just used to grab the form, scribble on it, fill it in and pass it to reception. And then I can talk to the patient and not be sitting on my computer, moving windows around and then trying that real awkward, bring a signature across type dynamic. So
absolutely. And I used to do the same, used to do it all paper, but I'd often do it, outside of the treatment room or behind the curtain on a clipboard while the client was getting changed. So like you said, you're not sacrificing that face-to-face by sitting in a computer and doing the work, and you can hand it to the admin team as you're walking the patient out to then grab your next patient. So sometimes those things are really handy, but with the introduction of AI and a lot of the systems now, it's now faster to do it in a system as long as you've learned how to do it.
So this brings us really to I guess the key features of Pogozo in terms of what are you able to do in that system that you really can't do within other practice management software?
Yeah, so our kind of motto from the get-go was, if you use it every day, it should, be in your PMS. So we've tried to bring the things that our clinicians use every day into the software. So things like doing your calendar, which is stock standard, doing your payments and invoicing, which is stock standard, your notes, which is stock standard, but then all of your communications as well. So within Pogozo, we've built our own emailing system. So you can, create beautiful emails with pictures and buttons and links, and you can send them out as newsletters, or you can, text message your clients through the system, or we actually have a mobile app so you can send a push notification to a client or things like that.
Yeah, nice. So you can ditch your MailChimp subscription, which is extraordinarily expensive for the amount people use it.
You absolutely can. So if you're using a subscription to do things like your emails and stuff, you can get rid of that. We've also built in an automated sequence system as well. So, if somebody cancels, you can have a 3-step automated sequence that they get an email an hour after they've cancelled, an SMS 2 days later if they have no future booking to remind them to rebook, and then another follow-up email a week later, for example.
Yeah, wow. That excites me as the business coach, because I'm like, these are the funnels and systems that you get direct return on investment for, because that just needs to get one extra appointment in and you've probably paid it off. for the month or whatever. Yeah.
Yeah, exactly. And, we know that those campaigns are really powerful. Like, we've seen the data that's come out of the systems that have been, plugged into your PMS using it for the last couple of years, and they can be really, really great. So we've built that into Pogozo so that we can, manage it with the triggers within our system, but it also allows us to customize things a lot more too. So, for example, in our system, you can tag clients, and you can tag a client within an appointment note. So you don't even need to go into their profile and tag them specifically. You can just do a quick key while you're writing their treatment note for the day, and tag them. And so let's say they're a new client who's come for the GLAD program. You can tag them as a GLAD program client, and then they'll get, let's say, an email every 2 weeks educating them about osteoarthritis and, why it's good for, like, why we do exercise and, our other first line modalities and things like that. So you can do all of your education pre-done through all of these systems as well, and make it really specific to client tags, client demographics, the appointment that they've just had, all of those bits and pieces as well.
Yeah, massively, massively underrated. It brings me back to, like, I interviewed Errol Lim about 3 or 4 months ago, and that was a big part of their digital system, was to make sure you've got an ongoing sequence of education getting in front of your patients, especially when you do deal in chronic diseases. And it's a no-brainer. If you've got a group like a GLAD program going, it's a no-brainer to have some level of consistent education to keep that front of mind for them, because otherwise they'll come home from one session and go, I haven't seen, today's session didn't make my knee 100% better. I'm a bit grumpy. Maybe I'll just stop going.
But yeah, those regular touch points to inform the patient of why this is important and why it's a long-term strategy is, invaluable. So it's not just your chronic diseases. Your women's health clients can benefit from this. Your pediatric clients, your musky clients for lots of your conditions, you can benefit from that too. So yeah, there's definitely a benefit in having that ongoing relationship with the client through email or push notifications or SMS or whatever your choice is. So that's one of our big features. Our second big feature, which we believe is a game changer, is our class management feature. So we have a class calendar within Pogozo, so really great for your businesses who run anywhere from 10 classes to 150 classes a week. Dedicated space for those classes, and then our membership feature that attaches to our classes as well. So if you want to create, whether it be your traditional 10-pack, which is seen in lots of clinics, or you want to try and move to that gym-based model where it's 2 sessions a week and, you're paying a monthly subscription or a weekly subscription, whatever it might be, we've got all of that built into Pogozo. So, if you're running classes and you're taking payments for all of those classes manually, if you're doing 40 classes a week, we can save you 10 hours of admin in a week, overnight, just by kind of implementing this feature. And one of the parts of the feature that I was really passionate about, because it was my job when I ran my clinic, is that we've got automated invoicing for this. So a client is on membership, they check into class, they get their private health invoice sent to them automatically. So you don't need to have to create that invoice. You don't have to assign credit from the past to, that invoice. It is all done in the background for you. So it is literally a click of the button, and you're already clicking to sign them in anyway. So there's no extra effort to get it done.
But because that's a really important friction point, right? Because for gyms running classes, it's just credit card and recurring revenue. For us in allied health, the patients need to be able to get that document and send it to their insurer. Their insurer is not signing up to a monthly class with repayments. So there is a layer of friction through that system where they just have to consistently be doing that, or our admin have to send them an email at the end of the month with 10 attachments and say, here's all your stuff. Good luck.
Yep. So we've automated all of that. So the client gets an email, you can send it through the mobile app. So, they've got access to it, and it just makes it really user-friendly for both the client to be able to claim, on the spot effectively, and then also for, the business in saving time. So that's, one part of Pogozo that we're really proud of, and is probably the part that we get the most feedback from our businesses saying this is saving us massive amounts of time and energy per week.
Yeah.
And especially making the admin team happy.
You're making user experience on the consumer end better, and you're making user experience on the provider end better.
Yeah.
That's a massive, massive win. And that's why Alex and I are running a free live webinar on Thursday, September 18th at 12:30 p.m. to show you exactly how to get ahead of these changes now. If you're a clinic owner who wants to cut admin, streamline systems, and prepare for the next wave of AI, don't miss it. The link's right below. Register today and bring your team along. Cheers.
Yeah.
And
Absolutely.
you're making life harder for health insurers because they're getting invoices properly sent to them. It's really flipping that narrative. Yeah, exactly.
And we've just released a new feature on that actually, where our system will actually pick up who the practitioner is, whether they're, so for example, if you're running a program that one class is taken by an EP, but one's taken by a physio, our program will now pick that up and so put the right item code in, that invoice. So a lot of invoices out there are being sent with 3 or 4 item codes all slashed together. We can automate that and make that even cleaner. We're really about trying to streamline and automate, all of these processes as much as we can.
That's really interesting because I think for most people in the physio specific space, the EP concept is there in the background. But again, it's just, all right, well, how do we integrate this into our system? Because now we've got different item codes and different fee structures and whatnot. And if you take a place like NDIS, which does fund EP and physio, a lot of people find that it's still frustrating because it's trying to juggle these two. You're inevitably often doing the same thing, or the EP takes over because the physio was sick that day.
Yeah.
But it creates problems which just end up, because it's really easy to ignore that problem when it's Friday morning and you're getting set for the weekend and just go, Sarah will deal with this on Monday. I'll just slide it through on a Post-it note.
Yeah.
And here we go. And that's how our debts build and build and build.
Exactly. Yeah. So if we can kind of automate that, that makes life so much easier.
All right, so that's it for part A of my chat with Alex Forde. In part B, we dive into how she actually built Pogozo and what AI means for practice management. And you can watch that right here. And if you enjoyed this, make sure to hit like and subscribe so you don't miss the next one. Thank you.